Welcome to the topic, drugs for shock and anaphylaxis. So what is shock? Shock is nothing but a syndrome characterized by the collapse of the circulatory system. Classification of shock, number 1 is anaphylactic. It's an acute allergic reaction and the severe reaction to the allergens such as penicillins, nuts, shellfish, and the animal proteins. These anaphylactic reactions actually, the antigen or the allergen, they combine with the B cell, then IgE, immunoglobulin E is released, and this immunoglobulin E, it will bind to the surface of the mast cell or the basophil, and then histamine increases the permeability and distension of the blood capillaries, and then these antigens, they trigger the production of the IgE antibodies. So anaphylactic reaction occurs as a cause of an allergic reactions on the skin. So it can be anything if a person is allergic to, can have that problem. Then another is cardiogenic shock. In the cardiogenic shock, there is a failure of the heart to pump the sufficient blood to the tissues, like left heart failure, in myocardial ischemia, myocardial infarction, dysarrhythmias, pulmonary embolism, myocardial or pericardial infections. In any case of, there are chances of helping a person going to cardiogenic shock. Then we have a septic shock, the multiple organ dysfunction as a result of pathogenic organisms in the blood and the widespread inflammatory response to bacterial, fungal, or parasitic infections. We can see the septic shock becomes the progressive from SIRS when the temperature starts rising, WBC count starts rising, then the sepsis comes, it's an infection, then the sepsis becomes severe and it causes the organ end damage, and finally it reaches to the septic shock, which is a severe sepsis plus hypotension, decrease in the blood pressure occurs. Then next is the hypovolemic shock, which is the loss of blood volume in which the hemorrhage, burns, profuse sweating, excessive urination, vomiting, or diarrhea occurs. So what happened when a hypovolemic shock occurs? There is a decrease in the venous return. So decrease in the preload in the heart, then the cardiac output decreases, hypertension occurs, perfusion failures or the tissue hypoxia occurs, organ dysfunction occurs, and finally the multi-organ failure occurs. So this can lead to the multi-organ failure. Next is neurogenic, it's for the brain. So vasodilation, which is caused by the overstimulation of the parasympathetic nervous system or understimulation of the sympathetic nervous system. So trauma to the spinal cord or the medulla, severe emotional stress or pain, drugs that suppress the central nervous system, they all can cause the neurogenic shock. Now, what are the symptoms of a patient in a shock? We can see here in the skin will become pale, clammy, and cool. Respiratory symptom is the rapid breathing and shallow respiration. Metabolism, low temperature, thirst will increase, acidosis occurs, low urine output will occur. In shock, the neurologically, the person will be restless, anxiety, lethargic, and confusion. And in the cardiovascular, you'll be having tachycardia, means increased heart rate, thready pulse, low cardiac output, and the low blood pressure. Then the initial treatment of the shock includes the basic life support and identifications of the underlying cause. Like if we see that a person got the shock, we should use a fan close to it, use the ice packs close to it, elevate the feet and wet the body and clothes spray. What is the immediate treatment for the shock that we should be giving? Keep the patient quiet and warm. Maintain the ABCs of the life support, airway, breathing, and circulation. We should focus the care on the specific cause of the condition, and we should restore the normal fluid volume and maintain the adequate blood pressure. After that, there are some physiological changes that occur during the shock and pharmacological interventions. So when the shock occurs, there is a fall of blood pressure, but the treatment can be vasoconstrictors right away. We give them norepinephrine. Inotropic drugs then be given, like dopamine can be given. Then loss of blood volume occurs and the treatment becomes the fluid replacement agents, like we have to give them the blood products, colloids, or the crystalloids. These fluid replacements, the first thing, infusions, they are given to replace the fluids lost during the shock. And these fluid replacement drugs are the blood products, which can be a whole blood, plasma protein fraction, fresh and frozen plasma, packed red blood cells. It can be colloids like the plasma protein fraction like Adway, normal serum albumin, albumin or plasbumin, dextrin 40, which is called as gentrin 40, or dextrin 70, it's gentrin 70. We can give hetastarch, that is hextend. We can use the crystalloids, and it includes normal saline, 0.9% sodium chloride, lactated Ringer's solution, plasma light, hypertonic saline, 3% sodium chloride, and 5% dextrose in water, which is called as D5W. Then we talked about the vasoconstrictors, which can be used and they are administered during the shock to maintain the blood pressure. These vasoconstrictors, they are given at early stages compensatory mechanisms, attempt to perfuse the body. In severe cases, these vasoconstrictors are required to stabilize the blood pressure and only used after the fluid infusion fails to raise the BP. Then we give this the vasoconstrictor. So the first choice would be the fluid infusion. The medications they're included in the vasoconstrictors are dopamine, norepinephrine, phenylephrine, or ephedrine. Inotropic drugs. These are also useful in reversing the decreased cardiac output that occurs during the shock. So reversing the decreased cardiac output includes the circulatory failure. It can occur during the shock if the cardiac output falls below the critical level. And a number of inotropic drugs are used to strengthen the myocardial function and improve the cardiac output. We talked about that. Then anaphylaxis. So anaphylaxis is the type of shock caused by a hyper response of the body's defense mechanisms. Symptoms of anaphylaxis, we can see here the mast cell will release the histamine. These are the granules which contain the histamine. So these histamines are released and they can go to the arterioles, they do the vasodilation and they do the edema. If this histamine will go to the heart, it will increase the heart rate, fast the heart rate like tachycardia, but decreases the cardiac output. If this histamine is going to the skin, it will cause itching and hives. If this histamine is going to the lungs, bronchoconstriction or dyspnea occurs. So the main reason for the anaphylaxis is the histamine release from the granules which are present in the mast cells in the nucleus of the cell. So pharmacotherapy of the anaphylaxis, epinephrine. It is the initial drug of the choice because it causes vasoconstriction. That's what we need and can rapidly relieve the symptoms of the bronchoconstriction because we are having vasodilation and bronchodilation. So we need a drug which can cause vasoconstriction and bronchoconstriction. So epinephrine is the drug of choice for that. It may be necessary to use other vasoconstrictors as well, and infusion of the large amount of the fluids may be needed to overcome the circulatory shock. Other than that, oxygen is usually administered immediately. Antihistamines are given like diphenhydramine, it's Benadryl. Bronchodilators are given like albuterol, Ventolin, or Proventil. And corticosteroids can be given like hydrocortisone. So the key drugs for the treatment of the shock and anaphylaxis, we use alpha agonists like phenylephrine, alpha and beta agonists like dopamine, norepinephrine. We can use beta 1 agonists like dobutamine. We can use cardiac glycosides like digoxin. We can use sympathomimetics like epinephrine. So in this chapter, in this topic, we understand about the shock, which is characterized by circulatory collapse. The initial treatment ensure the BLS and cause identification, replace the fluids as required prior to the vasoconstrictors. So the fluids becomes the first choice of the treatment. Other inotropic agents will assist with perfusion and cardiac output, and anaphylaxis is the hyper response from the body and is treated by the drug which is called as epinephrine. Thanks for watching this.